All right, today we're going to go over charting for Dr. Chrono. And once you log into Dr. Chrono, you should have a screen pops up similar to this. Have your name. It also is over here in the providers. You want to make sure you're on the correct date and the correct office. So you find your list in here of physicians or nurse practitioners, and on the offices, the facility that you'll be going to is listed over here. Right now, we're going to use Pam Greeley just as a test bed and just get into it. So on this page, there's 5 different appointments that are listed here, all a fictitious character named Education, and we'll go through the colors and what they mean. The red ones, red is new patients. So these are patients that are brand new to you. You've never seen them before. No one in the practice has seen them before. And they all require, particularly in the skilled nursing facilities, require a BIMS, a PHQ-9, and then the initial documentation template that we have created for you. The blue is follow-up patients, so patients that you've seen for the 2nd, 3rd, 4th, 25th time. You can reuse a lot of your old section in your notes. This should be a pretty easy documentation patient for you. However, there's a couple unique things that must be changed every time when seeing these new patients, and we'll go over that once we get into the actual documentation section. Yellow is patients that are, for billing purposes, treated as a new patient. PHQ-9, new patient, but can be a follow-up patient for your documentation, because these are patients that have left the facility and came back. And whether they've left for 24 hours, 48 hours, 2 weeks, 3 weeks, but they're new to the facility, as in they've been gone for 24 hours. That is all that means. But it's extremely important that particularly those patients that are in the skilled nursing setting, when they leave and they come back, they require a BIMS, PHQ-9, and you bill them as a new patient. This peach color, these are patients that takes a little bit special attention. It's the most confusing profile that we have, but as of right now, that's what we're using. So this is a patient that has been a new patient or a follow-up patient that has been requested by the facility to be seen for something specific, whether it's SI or newfound sadness and depression, anxiety that's being monitored or we need to monitor. These patients, you are addressing something specific, so they get put on as the referral color. Facility referral is actually what it's called, but it could be a doctor, another nurse practitioner, a therapist, the administrator, the DON. Doesn't really matter. If someone specifically pointed out an issue with the patient, they get coded as peach. This purple color, this is mostly for long-term and skilled nursing facilities. So if you see this on your schedule, we'll have a different tutorial just on GDRs. However, for now, in the long-term care facilities, I think a GDR is required on a patient. I think it's once a quarter or something along those lines. In the skilled nursing setting, it's every 30 days. But again, we are not really attempting a GDR, in my opinion, that we should be, unless you find it necessary. But a GDR in the skilled side, skilled nursing, and those patients must have some sort of documentation every 30 days that either any psychotropic they're on is contraindicated, or you are going to attempt the gradual dose reduction. I find that 99.9% of the time in the skilled nursing world, contraindicated is more than likely the appropriate documentation you're going to provide. Who's going to follow the patient? Who's going to see them outpatient? Are you going to be able to titrate them before they get discharged? There's just a lot of complexities, and how fast the skilled nursing facilities admit and discharge patients, that really following through with the gradual dose reduction is typically not recommended. Therefore, we just provide the facility with the required gradual dose reduction documentation that it's contraindicated at this time. And I have a canned template for that, so you don't have to come up with terminology or anything like that. It's really just a click of a button for you. So these are the 5 major types of appointments. There are a few more if you are in one of those facilities that have that, we can go over those templates separately. However, for now, we're just going to get into it with the new patient. So here's your appointment. There's a couple different screens you can view this in. You can, daily, exam room, provider, weekly. And again, what I find is that exam room is the easiest view that I use. And the reason why is these numbers up here. These are hallways. So every facility's numbering their halls differently in order to organize yourself throughout the facility, so you're not bouncing all over between different floors, different rooms, etc., etc. These are organized with halls in mind, so that way you can work through one hall, the second hall, the third hall, and you're not, again, chasing your tail all day in the facility. So let's say we're at Pam at Greeley, and we're going to see Miss Education, Education. Ignore the time stamps on the left. They really don't mean anything. So again, the schedulers are just going to stack patients up all the way down each hall, according to how many patients are in each hall, and you just go down the list. So we'll get started. So in order to start charting on this patient, you just literally click on the appointment box. A dialog box pops up. So for this patient is in room 1214. The attending physician is Dr. G. And this dialog box is where you can make notes specifically to a patient that will not end up in the note. So, patient, next week, we're gonna maybe start Zoloft if they're okay with it. Just any little things you wanna kind of remind yourself about, they go in this note section. It's all safe from and this will not end up in your note that populates when you upload into their EMR. So again, provider, patient name is here, their date of birth, and it's a Pam Greeley patient. It's a new patient. These are the hallways they're in. Again, none of this stuff you'll ever really mess with a whole lot, except for this notes tab. The schedulers put this information in for you. So in order to start charting, you clicked on the dialog box, this popped up. Now we go to view clinical note. You click on that. This comes up. Again, the only H&P section we ever use is under billing, but we do that last. And I'll have a separate video on billing and how we do the billing. This is just a clinical documentation video. So SOAP H&P will not be used in this tutorial, but you will eventually use this tab with the billing and diagnoses that we'll be entering here later. So in order to start charting on this patient, you go to additional. These are all the custom templates that we use in our practice. However, don't get overwhelmed. It's these two, sometimes three for the GDR. It's these two that you use 99.9% of the time. So you go all the way to the bottom. It's a long list. You scroll all the way to down, and the new patients, every new patient, or if there's a change of condition and you feel like a new BIM or PHQ-9 is appropriate, you can do them as often as you'd like. However, they are required on skilled nursing facilities, new patients, and return patients. So yellow and red are required. Everything else would be optional. This is required. This note is the note we use for all the initials, as well as all the follow-ups for any facility that we're at under any conditions. This is the note that you typically use. So we click on that. I'm going to have a separate tutorial for the BIMs and PHQ-9s. There's a lot of complexities in that one, and I want to have that as a separate video so you're not scrolling through all this information and listening to this entire video just to kind of go back and have a follow-up or a refresh on BIMs and PHQ-9s. So in this, a lot of pre-canned statements in here. A lot of this stuff is kind of trial and error that's come throughout the time. But again, you want to fill these out to the best of your ability. And any patients that scored 10 or higher on their PHQ 2 to 9, you don't have to do this, but you'll notice that your schedulers And we'll go over why this is. So the PHQ 2 to 9 that gets clicked on, there's a dialogue CAN statement that gets added to these because facilities want us to pay special attention to any patients who score 10 or higher on a PHQ 2 to 9 in the skilled nursing setting. So quick background on that. Criteria for follow-ups. So your schedulers follow an algorithm. So any patient you see will trigger a follow-up. Typically that is any patient on a psychotropic, any patient that scores 10 or higher on a PHQ 2 to 9, or 12 or lower on a BIMS, or the facility had referred the patient to us for something specific. Those patients automatically end up on your schedule as a follow-up. If at any time you don't feel that that patient is appropriate to follow, you can reach out to your scheduler, ask them why the patient's being re-added to your schedule every single time, and that way we're not missing anything. But you have the right to tell the scheduler, I don't want to, that patient isn't appropriate to see any longer. However, they just are following a set of algorithms. And so communicate with your scheduler if you see any anomalies, or give me a call. So again, we'll go back to the start of the history of present illness. You basically just fill this out. A lot of these drop downs, you can add as many or as little as you want, but obviously for A&O status, you're only going to want 1, 2 at the most. And current medication. So this can be copy and pasted from the facility EMR. Every facility uses different EMRs. Some of our facilities use point click, some use matrix. There's a couple other ones out there that are new to us. But again, you can copy and paste your current medication list from, and this will carry over. So this note, whatever you fill out will automatically be on the follow-up notes. So you don't have to constantly copy and paste everything in there. Your follow-ups should be quite simple as far as charting goes. A lot of this information, once you do the initial note for your first time seeing the patient, carries on every single visit afterwards. There's 3 sections in this charting that really become quite important. The first one is the psychotropic section. So even though you just added up to whatever they're on, 25 different medications, one medication that they're currently on, if there are any psychotropics that the patient is taking, those have to be added separately. And the reason why is the facilities are kind of hammering down on psychotropics. A lot of these facilities are getting scrutinized for psychotropics, so we want very specific rationale to make sure that not only is the patient on 3 psychotropics, we're okay with not only the individual psychotropic they're on, but we're okay with the 1, 2, 3, 4 psychotropics. I've seen as many as 7 psychotropics that they're on, and that you're addressing them individually. So you type out each individual psychotropic, the dosage, the reason why they're using it, all the normal stuff that goes along with charting a medication. So you can type in, let's say they're on 4, and then at the couple spaces, and then each box, there are macros we've created. Most of the macros are for the last part of the charting, but there is a macro that I'd really like you to use for just the psychotropic section. So after you enter all your meds that are just psychotropics, you can enter psychotropic continue. So this statement came up to me with the help of some of the corporate folks. This covers the documentation they need and you need in order to justify those medications individually, as well as the group of them together, and that you're aware of it, you're okay with the patient taking that those medications at that dosages together. So again, you just click on the box, macro, each box will have it, but you click on the macro section, psychotropic continue, the statement will pop up for you. So one of 3 very, very important components. We'll get to the other 2 here in a second. The rest of this stuff, moving on down, is pretty self-explanatory. Again, very easy to add, subtract, whatever you want to put in for the drop downs on almost all the charting that goes along with the initial patients and follow-ups for that matter. If there's ever a point where you want to describe something with any specificity, say depression, you want to create a note for that, there is dialog boxes on the right that are free type. You can type whatever you want in here that correlates to what you've been charting on. If you want to get more specific, it is not required, but if you'd like to do so, you're welcome to chart whatever you want on the right hand side to give some context to what you're charting on the left. So again, all this stuff is very, very self-explanatory. It's drop down menus. We always recommend using at least two of these, of anything you chart on the left here. Use at least two of the drop down options. Again, we keep going down here. Some of the stuff is kind of canned statements, but you can just highlight it, type over it if you'd like. So anything that you want to change, you certainly can. I tried to make this as easy as possible for most of your charting, so a lot of the stuff is already populated in the note for you. So once we get down, again, all drop down menus, pretty self-explanatory. The second part of the charting that becomes quite important is the psychotherapy. This is the billing code that correlates with the number of minutes of psychotherapy you provided. But every time you provide psychotherapy, whether it's a new patient, a follow-up patient, it doesn't really matter. This has to be a unique sentence or two that go along with something you did with that patient. So Mrs. Jones was sitting watching the news. She was discussing her increased levels of evening anxiety that also correlate to lowered quality of sleep. Provided sleep education or sleep hygiene education. So again, it doesn't have to be a novel, but it has to be a unique sentence or two every time you bill psychotherapy. So this, you cannot lock the note without putting something in this box. So number of minutes you provided, this will be blank on a new note. It will be in the note already. So if this was a follow-up patient, whatever you charted last time, all this stuff will be in here from what you charted last time. So if this is a follow-up patient, you will erase what you typed before, type in your new sentence, and you want to change the number of minutes of psychotherapy you provided. If you provided 18 last time, try not to use the same number over and over and over again. If you provided 21, 16, etc., etc. So make a few small changes in there. Don't use the same thing over and over again. The type of modality, you have to pick something in here. So let's say for this patient, we're going to do sleep hygiene, so it's going to be behavior modification. And I have canned statements in all of the type of psychotherapy provided. We use a lot in skilled nursing, long-term care settings. In this case, it'd be the sleep hygiene. Now, if you don't, for whatever reason, the patient that you're seeing doesn't really fall into these categories, and you want to write something unique, right here, there's an option for the type of psychotherapy that you provided, and you can type in as much or as little as you'd like. In here, if you're not using one of the canned statements, I would recommend at least making it 3 or 4 sentences to a unique psychotherapy explanation to justify your psychotherapy that you're billing. The third section that's the most important, I've already typed a few things in here. This is not pre-canned, but for this patient, if they were on Zoloft and Trazodone, for example, you'd have hashtag your depression, and then patient tolerating medication well, negative tardive dyskinesia, negative hyponatremia, whatever it is. You just type in the depression that's being treated, the insomnia that's being treated. So when there is no diagnoses there's only a couple diagnoses we can actually use, or categories of diagnoses we can use in skilled nursing. It's basically psychosis, depression, or anxiety are the only 3 real billable mental health diagnoses. Now, under those categories, it's limitless. But if it's not depression, it's not anxiety, it's not psychosis, For example, we cannot bill for anything under the dementia category. We cannot bill for anything under insomnia. So on a patient, say Mrs. Jones, you just got done seeing, she's not on any medication. She's never seen a psychiatrist or a therapist. She's been fine. She was riding bicycles and horses. She fell down, broke her hip, came in the facilities getting some therapy. We still want to get paid. So at minimum, the lowest level of billable diagnoses that we can use is adjustment disorder. So if you when there's nothing else to lean on, that's what we use. And you can put in a statement about the adjustment disorder. A patient maybe had some trouble sleeping the last few nights. Maybe the patient's had some anxiety about their health, how they're going to recover, et cetera, et cetera, et cetera. So if you do not have basically a psychosis, dementia, or I'm sorry, you can't use dementia. If you have a depression, anxiety, or psychosis diagnoses, then we use adjustment disorder. This will also spill over into the billing section when we create a separate video on that. Adjustment disorder is also the billing code that we'll use, and the billing diagnoses, so you can still get paid for your visit. And again, for continuing to monitor, something that you're following. And you'll notice some of these, they have little red stars on here. So these sections with the stars on them, you'll happen to notice if you try to save and lock your note, it will give you a warning. It will not allow you to save and lock the note until these sections are filled out. So if you get any warnings on your charting, then you have you missed something that was of dire importance, and you must go in and correct that before you're to save and lock the note. So once you're done charting, you're happy with everything you've got, you kind of take a quick peek at it. You go to preview note, and we're going to get a bunch of warnings in a second here. We're going to ignore that for now because I didn't sit down and do the entire note. But you can take a peek at it. This is exactly what your note's actually going to look like and populate. This is what's going to look like in its final version. So if you're okay with all that, you take a peek at it. You can go to sign and lock. So what sign and lock means? Sign and lock means that you are done with everything. So your billing is completed, and again, you'll have to watch the separate video on billing. But this is the section where you actually sign and lock it. So you want to be done with your charting, and you want to be done with your diagnoses, and you want to be done with your billing codes before you sign and lock. Signing and locking triggers the billing department and to send your billing codes and your diagnoses as a claim to insurance so you can get paid, as well as it triggers the back office staff to take your note, upload it into whatever EMR that the facility is using. We do all that stuff for you. But again, sign and lock is the last thing you should do in order to complete the note. Otherwise, you'll never get paid, and the facility will never get their documentation that they require. So I'll show you what it looks like. Don't get freaked out by signing and locking a note. It's very easy to unlock. What does happen though, just so you know, once you sign and lock a note, it gives a date and timestamp on when you signed and locked it. And if you unlock it and you make some changes, when you relock it, the new date and time will appear. So that is the only thing that really changes when you unlock a note and then relock and sign it. So you go to sign and lock. Again, we missed our lab. So you can click on this. It'll take you back to sort of the area that you need in order to sign and lock the note. It's told us the labs. I think the lab section is, I wasn't reading that like I just told you guys to do. But that's how you sign and lock and get ready to move forward. And that is the end of the basics of your charting for an initial and follow-up patient. Thank you.